independent study and time of placement. So first year is a lot less than other years. It's only about 4 or 5%. But as you go and progress further down the years, it increases dramatically. So for example, for Jenny, it's a lot higher now.
Mhm.
And then third year to fifth year, it's going to be pretty much 50 to 60% of your entire time on the course. So it's pretty nice having that placement in your first year because I guess helps break it up a little bit because it can feel quite demanding just doing biomed all the time in first year. But having that placement opportunity is really fun to break up the course a bit.
Yeah, I mean, I don't really have much to add. Once you get onto second year and above, it becomes a lot more dentistry related. As in first year, you've got a lot of overlap with, I guess, medicine, the human sciences side, cardiovascular disease, renal disease, which you might think, why on earth would I need to know it for dentistry? During when you get on second year further, it's a lot more dental focused. And yeah, honestly, it's a lot of fun, KCL dentistry. What we were saying here about DentSoc being a huge event. We had a trade fair last 2 weeks ago, last week. I got
Yeah, I
maybe
think so.
five different types of toothpastes. You get to see so many different dental companies, especially based around London. There's a lot going on here. Yeah. And last thing I'll touch on is exams. I know a lot of people stress about this, but I would say as far as dental unis go, KCL is one of the chillest in terms of exams. I have friends in other unis who are dying from work at the moment. But me, for example, we've got two exams in total in terms of summatives, multiple choice questions as well, which makes it a lot easier. There will be some essays, and they've introduced that, I think, for the new first years. But for us, we don't have essays, thank God. We have multiple choice answers, short answer questions, kind of like how A-level biology works. And then from second year onwards, you have a lot more kind of clinical things as well. So we have OSCEs to pass. We'll have things called cons exam, which is conservative dentistry, things like perio, which you would just do throughout the year. And generally, most people will pass these. You'll get a resit if not, but generally, most people pass it. So I would say just don't stress too much. I know it's different at different unis and with different courses, but dentistry at King's, pretty much everyone will pass. Okay, so why King's? Obviously, it's the best dental school. What more do I need to say? But in and into your answer, you want to give it a little bit more than that. I would say start off with a good introduction, summarizing the different factors that you're about to explore in a bit more detail. So this is why I use at least something like I chose this dental school due to a range of different factors, including my personal preferences when it comes to learning style and location, as well as the clinical experience it has to offer. What's really important here is I tend to find a lot of students just list off facts about Kings. Kings does this, the Kings does that, etc., etc. But the examiners are not looking for you to recite everything about Kings. It's not a knowledge test. What you want to make sure you're doing is relating it back to yourself. It is a motivation question. It'd be categorized under motivation, I guess, for dentistry or for Kings. So link it back to yourself. Why do you enjoy this kind of learning? Why do you want to have early clinical exposure? What benefit will that be to you? So this is meant to be a way for them to see that their course aligns with your style of learning and your preferences. Obviously, you'll be at this uni for the next 5 years. It is quite important to know that you're going to enjoy it. And yes, a bit of it is also knowing the course, know it inside out, so that you don't get anything wrong. It'd be quite bad if you, for example, said that, I don't know, clinical exposure starts in third year. Well, that's not true. So a little bit is get the knowledge right, but a lot of it is make sure you're making it relevant to yourself. So breaking down the three parts we've just talked about, starting with learning style.
So King's is a bit more of an integrated structure. You will have like a lot of different types of learning. So you're going to have a lot of in-person lectures, especially in first year. You're pretty much going to be in almost every single day for the first year, which can seem quite a lot, but at the same time, I do think it's a good thing because having a lot of online lectures, especially coming from A levels or wherever you just come from, gap year or whatever, it's quite a big switch going to not having any directed teaching. But it's quite nice having the in-person stuff because you sort of just know exactly what you need to know. And by having actual lecturers teach you, it's a bit easier to actually understand where your knowledge comes from. But at the same time, it is broken up. So we do have some small group seminars and tutorials, which is nice because you'll be in a group of about 8 to 10 people and you have like a teacher just going through short questions with you, which really helps consolidate your learning. And then you also have a lot of workshops and simulation labs. These come a bit further along in the year. So I think our haptics labs will start around the end of second semester of first year. And those are just like really great ways to actually build the clinical skills and knowledge that you'll actually have. Another thing that's a little bit interesting with King's as well, we have a lot of workshops that are like people that come in from afar to the university that come to us. So you'll actually have just random days every now and then where you'll have companies that come in or dentists coming from other parts, and they'll actually give you clinical sessions that you can either pay for or that are funded by the university. And you can actually practice clinical skills that you wouldn't really learn until maybe later on in the years, but it's just a great way to learn. I think only a couple of days ago, there was like a rubber dam, the amazing things that you're going to be able to do later on in the years. So that's quite a good thing that you learn about from King's. Um, one thing I will say about university, this is just uni in general, not really King specific, but it's going to be quite independent and it's going to be quite self-directed. Although lecturers will be as helpful as they can, at the same time, they still are really busy. So you will have to do a lot of learning yourself. But having that in-person side of it is still quite helpful because you'll have some guidance of where your knowledge is going to come from. Another nice thing about King's is that you will also have quite a lot of sessions with your dental hygiene and therapy course mates as well. It's a little bit less now in first year because we don't see them as frequently, but for a lot of bigger sessions, for example, like anatomy or cardiovascular teaching, we see the dental hygiene therapists quite a lot. And now even for clinical stuff like tooth waxing, we see them all the time. So it's pretty nice to be exposed to the whole dental team and see a lot of different people around you as well. So it's quite fun to have that big cohort size as well.
This we've already talked about in a bit of detail, but just so you can see how things are split across the different things, like your individual activity, self-guided, versus what's been taught together and what's on placements. But going on to clinical exposure, so we mentioned a little bit of this already, but generally, King's is known for having very early clinical exposure. If we compare it to other universities, most will start at the end of second year. Whereas King's obviously right from first year, you'll get things like placements. I think that's next this term actually, or a bit later on at the end of towards the end of first year. And again, that's something that's new that's being introduced this year. I think it's a great time to join King's, to be honest, because quickly expanding on a bit that Givan was talking about earlier, my second term for first year, I was in maybe 15 days total, very, very online. And I think that's probably one of the reasons why you might see that student satisfaction on different polls could be a bit low. It's mainly the admin side of things and people who don't enjoy being online so much. So again, that has changed. I did have some students come to me and ask why is King satisfaction so low? One thing to take into account, things have changed since. But going to the next part, we've got things like shadowing and nursing for fifth years. That's something that we're doing at the moment. So again, lots of exposure, even if I'm not necessarily completing tasks on clinics, like doing procedures, I'm still nursing for fifth years. I get exposure talking to patients, collecting them from the waiting rooms, etc. And again, this helps consolidate what I've seen in lectures into my actual learning and how this applies to patient cases. In second year, we've just been assigned clinical partners, and this is again great way for you to get more hands-on exposure without really harming patients or interacting with them so much. We practice on each other initially, so things like intro and extra oral exams will be done on each other. And then when it does come around to treating patients, and that is in February for me, so in a few weeks I get my first patient, we have one person being the nurse, one person being the dentist, and you just swap around every time. It's twice a week that we're in for clinics. So not too much, but honestly, a really good way to balance out your lectures and making sure that everything that you do is very hands-on and relevant to your course. It makes you feel like you're being a dentist. And something in interviews talk about is just the fact that it really excites you. You should be sounding very excited when you talk about this kind of thing. Show your enthusiasm, not just through what you say, but how you say it. Moving on, we've kind of set this second semester of BS2, but obviously this will continue on and you'll get more and more patients as you go throughout your journey. And in fifth year, you get opportunities to do community practice outreaches. So I know at the moment it's Portsmouth, half the people in the year will get sent to Portsmouth, and you get to practice in community practices around there. You also can get some scattered around different parts of London. So again, increasing the variety of people that you're seeing. Although I will say Guy's Hospital is one of the biggest dental hospitals, so again, lots of patients to see here.
So then going on to the location, obviously Kings is in London, but the best thing about that is the fact that it exposes you to so many different types of places, cultures, ages. There's just so much here. For me personally, I'm not from London, so coming to Kings is a bit of a shock, but it's actually so nice because being in around pretty central London as well, where Guy's campus is, you're able to get to so many different places so easily. And it's really nice by having that exposure to so many different people and so many different networks as well, especially when it comes to opportunities and networks. A lot of conferences, a lot of trade fairs are held in London, so it's pretty easy having that easy link and easy connection to different trade fairs, different conferences. Sorry, I think someone might be unmuted. Cool. Thank you. And also London is just really vibrant. It's really fast paced. There's so many different things to do. There's so many food spots around London Bridge as well. There's just a lot of things you can get involved with, especially when it comes to the voluntary side and society. So King's has quite cool dental societies that you can get involved with, such as Smile Society, if some of you may or may not know. And that's a really nice public health society, like a more of an outreach one that you can get involved with, and you can go, for example, to primary schools and teach children about oral health advice or different other communities as well. So there's a lot available to you, and there's a lot to take advantage of in the area as well, especially if you choose to stay in London after. So it's really nice to get that work-life balance as well, because it's really easy to go somewhere quickly outside London or somewhere fun around you. So that's a really nice thing about London as well, especially if you're not from here.
Okay, now more onto the interview structure. So the way these work, they have pretty much made it the same structure for a few years now, so you'd expect it to be similar. But it's a panel interview, 4 questions, 5 minutes each. So it's quite a short interview as far as interview goes. I think maybe half an hour max with the introduction time, etc. It is online, and you're gonna get two assessors. They both mark you separately, so you get two separate score sheets, and they would then add it all together, comparing against the scores of other people. The way it works is 10 marks for content and 10 marks for communication. Really important. That kind of goes to show that half of whether you get the offer or not is not down to what you say, but how you say it. So, I mean, this is just an example one from my feedback reports. You can kind of see that generally you want to be aiming for minimum eights across the board, I would say. And that is contributed to, again, 50-50. It balances out. So it's fine if, for example, you perform really poorly in one station, but let's say you get 10, so that everything else balances out. Don't get too concerned if one question goes badly. Just make sure you maintain your focus for the next few questions. The things in terms of communication, we've got a little bit on that later on, but that's things like non-verbal communication. I know it's difficult because it's online, but the main thing is don't look robotic. Things like smiling goes such a long way, just to make yourself seem friendlier. The more charismatic you are, the more confident you are as a candidate, the more likely they want you to be a dental student at their school and they want to see you become a dentist. Things like maintaining eye contact, nodding, so the non-verbal stuff, but also maintaining good pace, good tone, all of that will contribute to a good communication mark. The way I like to think about it is content, you kind of build up from the bottom. You start off at zero in terms of content because you haven't said anything. And then the more relevant things you talk about, the higher marks go. And honestly, like, for example, 10 out of 10 is possible. If you say everything they're looking for, you're going to get 10 out of 10. There's only so much that you can say. Communication, you always want to think of it starting off at 10, assuming you've made a good first impression, right? And then the more you start, I don't know, fidgeting, the more anxious you look, the more non-cohesive your answer is, the worse it goes. So it kind of goes opposite ends in that way. And that's kind of how you want to be almost marking yourself. I would suggest, because it's online interview, it's really easy to practice at home as well. So when you do go through practice questions, record yourself speaking, listen to yourself back, and see what the interviewers are seeing from you. In terms of the common question types, KCL is generally quite lazy. So that means that they tend to repeat the same type of questions. So it's a fairly good list here of what you want to prioritize. That's not to say they're necessarily going to have all of these this year, but looking at past trends, this is the most general ones. First of all, motivation, insight into dentistry. The main things they're looking for are to do with work experience. Make sure you're linking back to work experience. It could be questions like, Uh, what does the role of a dentist entail? Or what steps have you taken to ensure that dentistry is the right career for you? Know about the pros and cons of dentistry. So, what challenges are there? With challenges, make sure you always go back and say how you're going to overcome these challenges. They're not going to limit you there, but you're going to do this, that, and the other. And again, with motivation, just generally sound motivated. Sound like you're enthusiastic and you want to be a dentist. Second thing, skills and qualities. The main ones I've written down here: communication, empathy, resilience, teamwork, leadership, and manual dexterity. So for me, I had four questions, right? Two of my questions were skill and some qualities. 50% of my interview, really. And that's something that's really easy to prepare for. I think for Jivan, you also said there was
It was about the same for me as
about
well,
the
yeah.
same. Yeah, two questions out of four, skills and qualities. So important and really easy for you guys to honestly max out your marks on because once you've got prepared answers to this, you can use it in any context. Generally, what you want to do is think about where you've seen it on work experience, therefore, why is it important? And then an example where you've demonstrated it in your personal life. In terms of work experience as well, one thing to take into account is why is it important, right? The different groups of people. Something like communication, for example, you want to be talking about not just communication with patients, which is the go-to one for most people, but also communication within the team. Even extending from that, communication within the multidisciplinary team, how are dentists communicating with GPs, for example. And you want to use the same approach for all of these. I would strongly suggest you making a list and having both the examples go through these in some detail because generally they do like asking skills and qualities questions. The third thing here we have is professionalism and GDC principles, often phrased as some sort of SGT question, so situational judgment. What they're looking for here is, first of all, can you identify what the problem is? What is the issue with whatever's going on? And you want to be linking to your GDC principles. Sometimes it's a very specific scenario. For example, let's say it was a safeguarding concern where a child is coming in with bruises. That for you, immediately you should go, okay, well, that's actually going to be concerning GDC principle number eight, not identifying, sorry, raising concerns if patient at risk. And my key tip for this one is genuinely just be very explicit. So in my feedback report, for example, one of my questions was an SJT relating to GDC principle number five, which is complaints procedure. As one of my feedback points, it said good knowledge of GDC principles. And that's again going to contribute to my content mark. The reason I say be explicit is because if you go on and say, oh, the complaints procedure is really important, or let's say it was to do with consent, and you keep talking about how valid consent is really important, the different aspects of valid consent, great, lovely. I know that you know your consent and your complaints procedure, but I don't know that you know it's one of the GDC principles. So I can't mark you on it. I can't say candidate is able to identify the correct GDC principle. See what I mean? So just be very explicit and actually name drop the words GDC principle in your answer. Best way to do it is get it over with at the beginning, and then you don't have to think about it for the rest of the interview. Otherwise, some people who save it to the end might just end up forgetting name dropping GDC principles. That's kind of the first part, and then obviously explain the importance of this principle, make sure it's in context of the question. So talk about the effects on the patients, for example, is it going to influence patient safety, patient trust? What else can we talk about here? And then obviously you do want a correct course of action as well. And that's normally, for example, first of all, raising in a private setting, getting some context of the situation, what's going on, asking questions, making sure it's a non-confrontational approach. And then you want to explore their reasonings, offer solutions if that's relevant, kind of depending on what the question is. Let's say a dentist is drunk whilst in practice. In terms of resolving the situation, you don't want to jump straight into, okay, you're doing something wrong, let's kick you off the GDC register. Actually, I want to think about the ways I can support this dentist. Why might they be drinking whilst at work? Are there personal reasons for this? How can I support this dentist? But then you would say, ultimately, it is wrong. We're not allowed to do this because, well, for that example, patient safety. And your last bit is about whether it's relevant to escalate it or not. Generally, I would say something like if the person does not intend or is not complying to my advice, then you would have to report them to someone senior and get them to sort it out. Or if something's gone wrong, they've already made a mistake, let's say with the patient medication, even if it doesn't necessarily have an impact on the patient, or we don't know that, you would still have to report it because there could be a negative consequence associated. Otherwise, if it's something like, let's say a student was planning to cheat, you explain it to them why you shouldn't cheat, why it's going to be bad. They understand you, and you could say something like, assuming that they are going to comply to what I've suggested, there then is no need to escalate. So, kind of the correct course of action depends on the scenario given. Think about whether someone's going to get harmed. Think about whether harm has already happened. If you've already done something wrong, that would always have to be escalated and reported. Or if it's something that's not going to have any impact, something like the cheating thing, if they decided, okay, I understand, I'm not going to cheat, then there's no point. You wouldn't have to report them for something that they haven't done. The last thing, ethics, again, often phrased as an SJT question. The only difference is and sometimes they can be phrased together, so it could just be one big SJT question. And you want to link into your medical pillars of ethics. That's autonomy, beneficence, non-maleficence, and justice. If it's phrased as a should question, for example, should dentists be required to have good teeth? Should dentists be required to work in the NHS for a number of years, etc.? Something controversial. You want to make sure you've got a balance of yeses and nos and generally consider different perspectives. This is going to be something that makes you stand out. A lot of people only think from the patient's point of view, for example. How's it going to affect patients? Within that, how's it going to affect people who are high income patients versus low income patients? Let's say you're planning to make cosmetic treatments free under the NHS. That's going to disproportionately affect low income patients because they otherwise couldn't afford it. Whereas high income ones, does it make a difference to them? Well, if they can afford cosmetic treatments anyway, probably not so much. How's it going to affect dentists? Is it going to affect their workload, their burnout rates? How's it going to affect students, depending on, again, what the question is? NHS, long term, short term, different practices. These are all the different things you want to be thinking about to stand out in your answer rather than just give one point of view. It really shows the examiner that you're able to evaluate the different consequences for different stakeholders here. And the last thing is, again, if it's kind of a should question, try and give a conclusion, answer the question. What alternative solutions might there be, or what are your solutions for whatever question has been phrased? So you might say something like, in the short term, making cosmetic treatments free under the NHS isn't going to be sustainable because of the funding issues that we currently have, and the fact that there's a lot of other things that should be prioritized. For example, why don't we make dental checkups free under the NHS? However, in the long term, I can appreciate that there could be lots of good impacts, hence why that's something we want to work towards in a sustainable manner. Does that make sense? So give your own solutions or alternatives rather than just saying, no, it's a bad idea. Again, this is going to contribute to that content mark, making sure you've got a really good answer here.
I did
These are
just
the
want to make
general
one
ones.
quick point as well, sorry.
Mhm.
I was just gonna say, so if you look at like how the wording is right with everything, because think about when she was talking about escalation, she was saying assuming they comply or in this situation. You need to be really careful when you branch off that you use those words, just like how Jenny has, because that's the best way to make sure that you're thinking about every single possible scenario whilst also being correct in the situation. Because you don't want to not escalate because of something, or you don't want to escalate because of something. You want to make sure your phrasing's correct in that. And that's how you make sure that your communication is good as well for your answers.
Yeah, 100% agree. Just be very specific and clear there. And I think we are about to go through some different questions here. So, I mean, if we have any volunteers, that would be great. And the idea of this is to give you some time to practice, but everyone else also an opportunity to hear our answers. And then we'll go through what kind of a good answer is, what points you want to bring up.
Definitely. So the first question we'll be going through is why is empathy important in dentistry and how have you developed the skill? So if anyone is eager to answer this question, please raise your hand.
I am hoping we're going to get a yes from someone. It doesn't have to be a perfect answer, I promise. Yeah, okay.
Thank you,
Lally?
Lala.
Yeah, can you hear me?
Yes, we can hear you,
Okay, cool. Could I please have a moment to think?
of course.
Sorry, I can't start my video. I'm on my phone, but
That's all right, don't worry.
okay. So I'd like to first of all start by defining empathy, and especially why it's important in dentistry. So empathy is when you try and understand what a person is going through, and you try and change your approach based off how they are behaving, and try and make sure that you're dealing with this person in the way that best suits them and how they're feeling in that moment. And in dentistry, it's very important because as a dentist, you're responsible for making sure that your patients feel comfortable with you, and you're responsible for building a good patient-dentist relationship. And being empathetic is a major aspect of that, and makes it so that you're able to, have higher rate of success with whatever treatment that you're trying to undergo, that you're trying to put the patient through. Um, so one time that I saw empathy being used really, really well in a dental practice was during my work experience. I was working with a prosthodontist who was trying to explain to a child about uh, brace procedures. The child was very, very young. The child was around 8 years old, and the dentist could definitely tell, and I could also tell that the child was very nervous. He seemed very skittish. He was fidgeting quite a bit, and also wasn't really speaking up. He seemed quite shy. And I noticed how the dentist, took the time to communicate with this child and be empathetic. So he used open body language. He went down to the child's level and also made sure to take off his mask, do things like that in order to make sure that the child was as comfortable as possible. And talking to the dentist after this and reflecting upon uh, this scenario, I understood that just the dentist being that empathetic had a huge, huge impact. The child opened up, and the procedure went a lot better. The child seemed very comfortable in asking the dentist questions, and I think that it was overall a very successful encounter. And I think that empathy is really important, especially in scenarios like this, because you're going to see patients who, are scared of the dentist, are feeling quite worried, things like that quite often, especially as dentistry is one of the is one of the professions with the highest rate of patient phobia, and especially as lots of patients might have dental anxiety and things like that, we should be able to be empathetic and understand where they're coming from and meet them at that position. So looking at that and seeing how this dentist was empathetic and what an impact that had on their interactions with patients, I aim to emulate that in my own time. I volunteered at a care home, and I was responsible for working alongside other peers, dental nurses, dentists, normal nurses, and doctors as well, in order to provide the patients with the best possible care. So one scenario that happened during my work experience at this care home, sorry, volunteering at this care home, is that we were responsible for setting up a Christmas event. We were handling things like decorations, organizations of all the chairs, making sure that every single person who was performing for this Christmas event knew their role. When we were setting up the decorations, one of the residents I noticed wasn't very active. They were just in the side, they weren't really talking to anyone. And I approached them, and I used empathy by trying to understand how they might be feeling. I asked them why they weren't really participating, and they told me that no one had invited them to help with the decorations. And I felt quite bad for this person. I was quite empathetic and tried to understand exactly how they must be feeling at not being invited. And I changed my approach by addressing that. I invited them to come join us and made sure that they were feeling quite comfortable in talking to other members of the team and working alongside the other residents. And I think that this had a huge, huge impact on, how this person felt and how the task went as well. And I think that that really, really links well to dentistry, as you know, as I had mentioned before. Overall, I think that empathy is a very, very important skill in dentistry, and I have tried my best to develop this skill, and I'm looking forward to developing this skill more specifically with patients during my time at dental school.
Perfect. That was a really, really good answer. What we'll do is we'll go on to the mark scheme slide where I've just put a couple of points for like content or communication, and we'll just see how you went with that. I think for just like overall feedback, just from what I've heard from you, I think your communication was really good. You gave like a good logical structure with how you answered as well. I like how you introduced the question first and you gave a good explanation of empathy, and then you break it down quite well by first going into how you've seen empathy in the dental setting, and then you explained the impact on the patient as well. I like how you introduced that quite nicely. And then you led on to talk about how you've demonstrated empathy in your own work experience. And you have like a nice, good link back to dentistry in the end, which is really nice. I think you mentioned some really good points. We're talking about dental anxiety and fear. I like how you had a bit more conversational flow to your answer. And you still kept the professional language in your points as well, which made it feel a lot more conversational. Obviously, I can't see your face, so I can't give you like a good comment on eye contact and body language. But I think just from hearing your tone and pacing, it still came across really well and it was quite coherent as well. So I think that you did really well in that sense. Again, I like how you linked empathy back to your personal experiences. You gave a good example of the dental setting, then also your own. And I made a lot of good points. I made a lot of good feedback for you for that answer. So I think overall you answered that really, really well. Maybe for points of improvement, trying to give like a GDC principle link, could your answer could help take it a little bit further. For example, when talking about patients in that sense, by having that really, really good empathy, it can also help with trying to get more valid consent from them. So you can link that to the third GDC principle with obtaining valid consent as well. As if you're able to effectively understand the patient and if they're able to feel more comfortable in the situation, they're more likely to ask effective questions of you and you're able to get that proper consent from them. It's just more valid in that situation. And that's just like another way you can maybe take your answer a little bit further, if that makes sense.
Okay, thank you very much. Would it be also possible for you to give me like a score? If that's okay.
If I was to score your answer, um, okay. So I would say your content was definitely really strong. You had a lot of really good points. I would probably add a little bit more talking about the GDC principle link in there, just to take your answer a little bit further and explain more about the consent side of things. I would say your communication was really strong. Obviously, I can't fully score communication because I can't see your face and like give you that body language, etc. But just from tone and voice alone, I think you still came across really, really well. For content, I think your content was really strong. So I'm definitely thinking around like an 8 out of 10 for that. You had a lot of really, really good points. For communication, um, just based on tone alone, if I exclude anything about like body language or eye contact, I think your tone and pacing was really well for the answer and you came across really articulately. So that was really good. So I think obviously you can't take my score to too much consideration because I'm not an interviewer myself, but I would still say your answer was really strong. But I think there's a couple of ways you could improve definitely with maybe taking your answer a little bit further with talking about consent or giving like a GDC principle link in there.
Okay. What score would you give me for communication? Sorry.
For communication, if I just base it on like tone and voice and pacing, I think that was really good. If I exclude everything else, I'll say probably like an 8 or 9 for the tone and articulate nature of your
Okay.
what's called your point. But I
Okay.
can't give you like a proper score, just I can't access body language and eye
Mhm.
contact.
Yeah, yeah, no worries. Thank you.
No worries.
Okay, next question then, which I'll go through, is an SJT ethicsy type one. And this one's quite standard in terms of the type of SJT question we're talking about. It refers to both GDC principles, or you can at least. A good answer should refer to GDC principles, and also your ethical pillars. A lot to say for this one. Does anyone want to have a go? So I'll give you, well, let's read it out. So you're a dental student on placement. You notice that the dentist you're shadowing often makes rude remarks about patients after they leave. What are the issues and how would you approach this? Amen.
Yeah, can I have a minute to think about this, please?
Yeah, of course.
Okay, so as a dental student on placement, knowing my position of authority, I wouldn't go straight away and confront my dentist. I would likely, I guess, pull them aside after they've done an appointment with a patient and ask them if there's any reason they're acting like this today, if anything's been going on in their lives that's causing them to have like this kind of attitude or rudeness towards patients. And I try to sort it with my dentist first and see if there's any problems I could help them get over. Um, However, if they keep resisting advice or they keep being rude to the patients, then I'd ultimately have no choice but to go to higher authorities such as like the dental directors of like the clinic, the people who own the clinic. So I'd go to them and I tell them about this problem and I'd ask for if they could sort out instead, because knowing my position as a dental student, I don't have much authority and can't do much by myself. So, but yeah, I'm kind of struggling with talking more about this because, as a dental student, you can't do much, can you, except for asking them to be nice.
Yeah, good. If we think about the first part of the question, so what is it? What issues are there? Is there anything you that comes to mind for you? If not, we'll just go through the answers. But
I
what?
mean, it depends about like the dentist, like who they're making rude remarks about the
Mhm.
patients too. Like it could be a breach of confidentiality if it's talking about a specific patient notes. Like if they're complaining about the patient having I don't know, a loose tooth or something towards another dental nurse who wasn't in the room, then that could be a confidentiality breach. It could also maybe be, I don't know, actually, I don't know.
That's a really good point. See, this is the kind of things you want to be saying within your answer. That would have given you marks because it ties into the ethics side of things. In terms of expanding on just the bit that you were talking about, absolutely confidentiality is a good point. But then on top of that, make sure you mention the fact that it goes against GDC Principle number 4, because then I can't, like I said earlier, be explicit. Otherwise, I don't know that you know it's a GDC Principle. I know it feels really silly, but just make it really explicit when you talk about this kind of things. And for this question, you kind of want 50-50. What are the issues and how do you approach it? So in an answer like yours, the main flaw would be you want to talk a lot more about what the issues are. I guess in terms of where you structure it, there's no right answer. I would generally say go through the issues first because this is an ethics-y type question where they want to be hearing your GDC principles, your ethical pillars in order to gain those marks. And then I would say logically it makes sense to the secondary move on to how would you approach this situation. Does that make sense?
Yeah, that's
Yeah. I mean, other things that could be actually, I'll let you guys have a think. Could I get maybe some people raise your hand, shout out? What other issues are there going to be here? Why can't we make rude comments about patients?
I've got a few points.
Yeah.
So obviously by making rude comments about the patient, um, obviously they're gonna feel very, very like they'll feel very offensed. Like they'll feel very what's the word? They they might feel like scared to go to the dentist, and they might feel anxious. They may not want to come back, and that can obviously cause quite a few issues.
Yeah.
Um, yeah, again, like if they're scared, they might tell their family, "Oh, this dentist is bad," so they may not want to come back.
And that links to a very specific GD's principle. Do we know which one that is?
I'm not too sure.
I think someone put it on the chat anyway. GD's principle number 9 is all about the trust within the profession. So exactly what you were saying. If a patient overhears this, that's going to be quite bad. Patient could be overhearing the fact that, I don't know, the dentist is making fun of their breath or I don't know, the lack of teeth. Whatever it would influence badly on the profession as a whole, but also that particular dentist. Someone in chat also did say it could make them lose trust in the profession. Absolutely. And I think that's kind of the main one or the most obvious one to point out when I ask this question. The only thing I would say is, does it therefore make it fine if the patient doesn't overhear? That's kind of the key issue. When I ask this question to students, 9 out of 10 people will say, oh yeah, okay, well, it's going to be bad because patients could overhear and that would have negative consequences. Are we then saying it's fine for a dentist to make rude comments if the patient isn't in the room? That's the kind of thing that really top level answers people will be thinking of. Go that step further. Otherwise, it comes across, can you see what I mean? It's kind of you saying, oh, it's fine if the patient doesn't overhear. That's fine. We can make rude comments in that sense. So the other things that we talk about is, which I've got down here, GDC principle line we've already talked about. GDC principle number one. So kind of expanding on what, sorry, I don't know who it just said, but in terms of impact on patients, it could harm their self-esteem, self-confidence. That's going to be not in their patient's best interest. You could link it to non-maleficence. So the fact that it could potentially be harming someone's mental health, for example. Again, we're not just taking care of the oral health, but holistically. But generally, and this is really important, you would pretty much have to say this really to get full marks, something to do with justice. You're not treating the patient with respect. And again, you could talk about the different type of comments that could be made. So depending on the comments made, it could be discriminatory, it could be derogatory, and that would show underlying biases, which would be of a bigger issue compared to just the fact that patients could overhear. The other things you could talk about is the fact that even if patients aren't here, you are expected to act with integrity. You're setting a really bad example for other dental students. Remember, this person, you're a student on placement and a dentist acting this way. Luckily for you, you know it's the wrong thing to do. But let's say there's another dental student on placement. They overhear this. They think, okay, that's great. I can also make these rude comments. Can you see how the cycle's going to continue and escalate? Which means that actually is not just having bad consequences on if a patient overhears, but the next generation, I guess, of dentists would also be thinking this is the fine thing to say. And the last thing I have here is it could very easily make the team uncomfortable, and that would go against GDC principle number 6, working effectively with colleagues. If, let's say, again, nothing to the patient is in the room, but the fact that I'm overhearing this as a dental student, or the fact that perhaps a nurse is overhearing this, or another dentist is overhearing this, it could then make me reflect and can again damage things like self-esteem. Let's say the dentist was making fat phobic remarks. And then, as a nurse overhearing this, that would then kind of change my perception of the dentist. I'm perhaps not going to work so well with the dentist. That could make me feel insecure. So think broader is the only thing I would say for this question. I see so many students just going down the route of if a patient overhears, this would be bad. First of all, that's based on an if, which again is you want to be more specific to the question. So this question says the patient is in the room, for example. What other consequences could we be talking about? So many GC principles, GC 1, 9, 6, justice, non-maleficence, even beneficence, if you want to talk about how it doesn't align with their best interest, going against beneficence. So many things to talk about here. In terms of course of action, generally it was said very well by Mun. So, private setting, non-confrontational manner, there is definitely a difference in authority, so you don't want to come and attack this dentist. But instead, you want to gain context by asking questions. Maybe you misheard it, get some context here. One thing I would say is, you said that you can't do much as a student. Yes, that's right. But do the things that you can do, and that's getting some context, and you still want to raise it up. So maybe asking the dentist, oh, why did you feel it was appropriate to make this comment? Getting into their headspace essentially. However, you would still be able to remind them of their responsibilities and explain to them why it's bad. And again, in terms of escalation, you want to encourage them to change their behavior. But if it does continue, you want to appropriately escalate it. Obviously, at that point, recognize that you're only a dental student. You can't do so much. You can't kick them out of practice. That's something for the dental practice manager or clinical supervisor, whoever it is, to sort out. So at that point, you would escalate it. But that's almost the last resort. You want to talk about everything else before going on to the fact and saying something like, because I'm a dental student, I don't have full power. That would be at the very end. Any questions on that? It's quite a difficult one. This one is a really nasty question. Well, it's not. I like this question. I think it's really interesting, and I would say it's a very differentiating question. You can really tell who's a top level student by a question like this, where loads of people will say one thing, but the top level students will go above that and talk about different aspects. Who else might be affected? The last one we'll have a go through is this one then.
So if we could have another volunteer as well to answer this one. So I'll
Okay.
just read out the question as well. So you are treating a patient who discloses that they are HIV positive. They do not want to tell the rest of the team. Describe how you would manage the situation professionally and what ethical issues you would consider. I
I
think,
did see on the group chat, so on the chat a while ago, a few minutes ago, someone iPad said that they want to see the next question.
okay.
That was me. Can you hear me well?
Yeah, we can hear you.
All right, thank you. Is it okay if I have a moment to think about the question, please?
Yeah, no worries.
Thank you very much. Okay. Okay, so currently as a year 13 student, I can appreciate this situation as a very complex situation in which I will aim to act as ethically possible and to ensure optimal patient outcomes. So the situation outlines that I'm treating a patient who is HIV positive, and in which they do not want me to inform the rest of the dental team. So in this way, the medical pillars that come into mind are the pillars of autonomy and justice. So justice in the means by which I should ensure that the patient is treated equally and fairly in comparison to other treatments, in which I should not discriminate against them due to their HIV status. And by not telling the rest of the dental team, this allows me to uphold, or by acting in their best interest, this allows me to uphold the medical pillar of beneficence, in which I aim to act in the best interest of the patient. So in this situation, me as a dentist, I do believe first it's important to inquire to why the patient in question doesn't want me to inform the rest of the dental team of their HIV status. Through, say, for example, I was not to tell the rest of the dental team, this would allow me to uphold the GDC principle of maintaining patient confidentiality, in which I keep their status of HIV. Let me rephrase that. So I keep the status of HIV confidential. So before I do that, I do believe it's important to, as I said before, inquire to why the patient wants it to be private. So in this way, I would ask them in an empathetic and open tone in order to allow them to feel valued and listened to. So through this, for example, I could use non-verbal cues and positive reassurance, such as to ensure that the patient feels more comfortable and more able to tell me about their condition and why don't want me to. However, I do believe it's important to consider the fact that if the patient is HIV positive, there is a risk to others of transmission. So, in depending on the dental surgery or um, the dental treatment that's happening, it's important to consider whether this confidentiality should be breached and say what's a risk to others. So some examples of this is, say it was a transmission, no, a treatment involving, for example, blood, such as a implant or an extraction. In this case, I do believe it'll be important to tell, for example, the dental nurse, as dentistry is inevitably not a four-handed career in which the dentist will have to work alongside the dental nurse in order to optimize patient outcomes. So through, for example, me having to tell the dental nurse to ensure safety of the dental team, this will allow me to ensure that we are able to provide the best treatment possible for the patient. So this would require, for example, maybe we may need more personal protective equipment, for example, through extra gloves or face masks or extra suctioning. Say, for example, we're doing a treatment with blood. However, if the patient still goes against and doesn't want us to inform the rest of the dental team of their HIV status, I do believe it's important to ultimately ensure that the patient is able to receive treatment at the end of the day. So this allows us to uphold the medical pillar of beneficence, in which we act in the patient's best interest. So in this way, for example, we could possibly suggest alternative modes of treatment to the patient that may, for example, not require blood or may not require us having to tell the dental team, as ultimately you have to obtain valid consent from the patient. So you must obviously respect their wishes. Say, for example, they want to keep the status confidential. However, ultimately, my role as a dentist ensures that I put patient interest first, ensuring that the patient is able to receive optimal treatments, as dentistry is a career in which you as a dentist has to make sure you strive towards optimal patient outcomes. So in this situation, I do believe it's important to adhere to the patient's wishes and they want to keep their status confidential. However, say for example, there's a risk to others of transmission or say for example there's a risk to others to blood transmission or information of their status may affect how the treatment continues. it may be important to break this confidentiality. However, at the end of the day, it's important that we uphold the patient's wishes and ensure that outcomes are positive.
Perfect. Thank you for that answer. I'll just get the mark scheme up for you now. But I think overall that was a really, really strong answer. I really liked how you structured your points. Um, I think you started off really, really well by first outlining the scenario and going over the key points, and then you slowly break it down quite well into each separate individual argument. And I like how you went through all the nuances of the answer as well. So
Yeah,
you first went through like standard infection control procedures, and then you started talking about confidentiality, which is really good. And I like how you gave a GDC link. I also like
yeah,
how you spoke about each ethical pillar as well and how it applies to each scenario, and you gave good applications of it,
yeah,
especially with justice as well, treating the patient fairly, make sure there's no prejudice to them, which is really good points to consider. I
yeah,
then like how you went through the nuances of the situation. So, although obviously you want to adhere to the confidentiality of the patient, but you still need to
yeah,
consider the scenarios that confidentiality can be breached, which you mentioned really well. For example, exposure,
yeah,
and that was really good because it made sure your answer was considering all different parts of the scenario. So it was much more evaluative, and it
yeah,
was a lot more careful in consideration. So I think overall it came across as a really strong, well-crafted answer with a lot of good points considered.
yeah,
Um, I think there wasn't really too much additional I could possibly add to your answer other than maybe going through maybe potentially like non-maleficence to ensure no harm comes to the patient, but
yeah,
maybe through like stigma or trying to understand that aspect of it. But you still mentioned this briefly by talking about you want to make sure that the patient's wishes are understood and maybe their reasoning why they don't want to share. But maybe just being a little bit more explicit in your points of suggesting the reasons why the patient doesn't want to share, rather than just saying, I can understand, I'll speak to the patient why they don't want to share their HIV status, but just being a bit
yeah,
more explicit by saying, but maybe these possible reasons, it could maybe just add a little bit more to your answer. Of course, that
yeah,
is me being a bit more nitpicky, but it's just like small points you could potentially add in just to make sure it covers all bases. But
yeah,
overall, I'd say definitely really strong in every single point that you made. So they came across really well. Um, Moving forward to communication, again, obviously I can't see your face, so I can't like comment on body language and eye contact,
yeah.
etc. But I think still your tone and pacing was really well, and you're very
Thank
articulate with how you came across, and the language you used was correct as well for the answer. So it
you.
came across really well. Um, did you have any questions at all about everything, any feedback or points I've given?
Hmm. No, not really. In these ethical scenarios, you don't always have to mention, or do you have to mention every pillar, or can you choose a few?
You don't have to mention every single pillar. If it doesn't feel relevant to the scenario, then I wouldn't mention every single one. I
Yeah,
would maybe pick like one or two, like you did, and that's
yeah,
completely fine because you don't want to also go too much about the ethical pillars because it sort of takes away from the rest of the answer as well. You want to
yeah,
make sure you're considering all the different points that you're meant to say, and if it feels relevant, then slip it into your points like you did.
yeah.
Because I wouldn't focus too much on making sure you say every single one. As long as you've
Mhm.
said like maybe one or two and you've been a bit more explicit of your points, that's completely fine.
Okay. All right. Thank you very much.
No worries. That was a really good answer.
All right. Thank you.
Okay. Um, that is it from us. I know it's just about on the clock, but I know we started a bit late, so we'll try and go through some questions. I have been typing away, sorry, during that last slide, when Jivan was doing the question, but I've tried to answer at least a few of them. The one that's come up quite a few times is how do you know it's four questions, 5 minutes each? First of all, that's the way they've done it for the last few years, but also I had some students tell me for this year rounds that you will get an email 48 hours before when your interview is meant to be. And in that email, they will tell you four questions, 5 minutes each. In terms of timings for this, it is panel, so it's not like an MMI circuit where 5 minutes is up, stop it, move on. But so there is a bit of leeway. If you go for like 5 minutes, 15 seconds, they probably won't stop you as long as it looks like you're rounding off your answer. That's absolutely fine. But if you're at 5 minutes and you've only just introduced a new point, they would cut you off. The reason for that is because it's otherwise unfair. And also there is a time limit for the interview. They'll probably have another interview after you. They can't let you just keep talking, for example. Going the opposite of that, if you have 2 minutes in and you finished up your answer. That would then probably prompt some follow-up questions. Generally, follow-up questions aren't necessary. So out of my four questions, I only had one follow-up question for one of those. So generally, there should be enough to talk about, and they can group questions together. So one So one like common one, for example, is about what steps have you taken in dentistry and what are the pros and cons of dentistry. There's quite a lot to talk about there. It's almost like one full station if it was MMI. So try and bulk up your answer and expand it to 5 minutes. If you do finish early, they will either tell you just to move on to the next question, or if you finish, or they could say something like, "Oh, you have, 2 minutes left. Is there anything else you'd like to expand on?" In which case, that should kind of be your cue to think, "What else could I expand on?" And say something like, "Oh, expanding on
Work
my
done.
point from earlier, dot dot dot," or "Oh, another
Work
consequence
done.
that
Work
I've just thought
done.
of
Work done.
is dot dot dot."
Right. I need to
So
email this guy.
timing wise, aim for those 5 minutes. If you go slightly over, fine. Too much over, they'll cut you off. Too little, they can ask you prompts or ask you to expand. Um, yeah, I'm just
Yeah, I was
yeah.
just going to say, I would say like King's is a bit more like a semi-structured panel interview. So although it is a panel itself, treat is almost like having little stations in each one because each question is scored individually as well. So even if one went a little bit worse than the other, it's not going to affect the other score as long as that question you do next is going to go really well. So just don't take it too much to heart if like a question doesn't go as well as you think it did, because the next one can still make up for it. So it's not like as um it's not as like imperative that every single question goes perfectly because if one doesn't go as well as the other one, you can still make up for it because they're all scored independently.
Okay, some other questions. Does someone have a question? Shout out.
He's here
Yeah,
in the parlor.
sorry.
Okay.
I,
Coming now.
okay. I don't think that's meant for us. If you could mute yourself,
Finish my work.
let's see if we can get that. Anyway, sorry about that. Some other questions.
Just looking as
Okay,
well.
so does asking the interview question at the end make a difference? No. Generally, I would say, well, at the point you finish your interview, right? They've got the marks written down. They're not changing that based on whatever question you ask. So generally, I say just don't ask a question unless you actually have a genuine question that you want to know about. Just avoid asking it entirely because it's not going to make a difference to your mark. The other thing is I just saw. Maybe I didn't. Oh, yes. Jotting things down. Do not do that. First of all, you're not allowed to, which I think they should tell you. If they don't tell you, avoid doing it because they might think you're cheating. Obviously, you're at home. They don't know whether you've got notes in front of you, like pre-written notes of your interview answers. And if they do suspect that you're cheating, they can just remove your offer and like automatically say no to you. So just avoid that. Don't have any notes in front of you. Don't have things on the wall opposite you that you're going to be tempted to read off of. I promise you, it's not worth trying to cheat. Whoever's got their hands up, do we have questions? So,
Hello,
yeah,
can you hear me?
yes, I
Yeah, we
can.
can hear you.
I know this may be a question that's not something that you could really answer, but I haven't received my interview yet for Kings, but I've also not been rejected yet. I just wanted to ask, is that a sign or like, is that an indication that I may get an interview later on, maybe in February or March, or is it
This
like
it,
I
I'm
could
listening
still
to
get
something.
rejected or anything?
Good
Leave it and
question.
come out it to dry. Or you can
I
iron
don't
it.
think I have the power to mute people,
Yeah.
unfortunately. But anyway, sorry. Yeah, good question. I'll let Juven talk about his year in a second. For my year, they did it in loads of different batches. So people were
Hmm.
still getting interviews when it came to February. At this
Okay.
point, don't be too concerned. No answer is a good answer, if anything, because there very, very likely will be extra batches coming out. Was that the same for
Hmm.
you?
Yeah, I was just about to say the exact same thing. I think similar thing. I remember someone saying because I messaged like someone in third year and they were saying they had like an interview done around February time. So I King's definitely is in batches. So I wouldn't be too worried about it. And also they'll only give you about 2 weeks of notice before your interview. So
Hmm.
they're only going to tell you pretty much just before it actually happens. So I wouldn't be too concerned.
The other thing,
Okay.
question I've just seen pop up is, do they release offers in batches? The answer is yes, for my year at least. So I was in the first batch, and that was in April. My last interview, it took so long, but got there in the end, and that was the first batch. The last batch was by the end of April slash early May, which honestly feels ridiculous because at that point you're getting into the A levels. But that's just the way it works. Kings is quite slow. Again, wouldn't be surprised if Kings would be the last offer that you get, and they do it in batches as well. So again, no news is good news until you get a rejection, I guess.
Yeah, I was about to say the exact same thing. Like, I think for me, it was also first batch, but that's still April, which is still really late. So, yeah, like just like Jenny said, no news is sometimes good news as well. So, don't be too worried if you haven't had anything back until the later ends of the year.
We'll do maybe two more questions from people who's got their hands up.
I'm just going to see if like who has hands up first. Faith, do you have anything? Do you have any questions?
Yeah, I have a question. So for the interviews, a lot of people will have around the same scores, right? So do the interviewers take any other factors into account which would push other students forward to get a place?
From From what I know, I'm not too sure if they consider other factors. I believe Kings, what they will do is after they've interviewed everyone and they see how many offers they can give, they'll probably just like have a cutoff point after they make that number. I'm not too sure if they have a lot of people with the same score, what they do. Jenny, do you know, in fact?
In terms of the same score, I did read, I don't know if they still do it, but your personal statement is something that they could refer to. If you've got the same score, so they'll read both personal statements and see which one's better. UCAT generally they won't look at post-interview. But other than that, because they don't have any like specific information of how they rank people post-interview, you're just gonna have to hazard a guess. So I would assume that you could use personal statement, but other than that, I'm not entirely sure. Sorry.
Okay, thank you.
No worries. I'm just looking at anything else in the chat that's not been answered as well.
Uh, One thing that I just thought, will the interviewers be nice? A lot of the interviewers will be clinical staff or kind of different members of the dental faculty. But also, I have a few friends who are in third year who are also interviewing. So yeah, I would generally say students are friendlier than like clinical people. But yeah, I would say they were quite friendly for me at least.
I would say the same. Like I think they're quite friendly as well. They're not really going to be intentionally rude at all. They just sort of want to like get you a quick assess as quickly as possible. So most of the time they're quite friendly. So I wouldn't be too worried about that.
And the last thing, well, actually, who was it? Milana, who asked about someone else also thumbs up this. So about specific research at King's. Uh, King's does so much research. If you just type in to like Google search research at King's, dental research at King's, I'm sure you'll come across a lot of different articles from King's itself. And there is things like Dental Research Society at King's, things for students to join too. Also, well, actually, was it? Yeah, if I like to get involved, yeah, absolutely. So there's like a BDSA research summit, for example, lots of different things you can get involved in, and even like just asking lecturers to get involved in different research is absolutely fine. In first year, you'll have a research project, the student selected
Mhm.
component, where you basically choose a title. Ours was about dental simulators, different groups of people, and you have to do a whole research project on that and present it. So lots of opportunities for research. If that's something that interests you, definitely talk about it in your why Kings question because Kings has lots of opportunities for research. This really interests me. For example, I've done this, therefore I want to come to Kings. So you can see how you can link it back to yourself in terms of, getting an answer there.
I just wanted to quickly elaborate on Jenny's point as well, because they changed the course, obviously for our year. So for us, they've made like an evidence-based dentistry module. So in that, it's almost like a mini EPQ, where it's about a 2,500 word essay about, they give you like a list of 200 titles and you can choose one from it. And in that, you can pretty much make a whole EPQ about whatever you want, really, in that. And it's really cool because you get to research what you want and you get to talk to academic supervisors who a lot of the time are like the leaders in their field. So that's quite a nice opportunity you can have. And they've also said for the module, they will take the top 10 students and then they will be able to look at possibilities of getting like a presentation done. And they said if they have any outstanding students in the top one or two, they'll look at publishment as well. So there's a lot of like good possibilities you can get with Kings, especially in the research way. So if it comes up in the interview, definitely mention it, definitely talk about it. Anything that you've done personally as well. It's a really nice thing just to add into your answers.
Yeah. I saw that Maya had raised her hand earlier and also put a question, and someone else did as well about a com. So KCL a com, look us on the website. I know generally people think it's so expensive, and yeah, I would have to agree. London com, unfortunately, is on the pricier end, but I would not regret anything about it. So I think both of us, me last year, stayed at GDSA, which is Great Dover Street Apartments. That's the one that's 10 minutes from campus. Most dental students will stay there. And it's, yes, the rooms are small. Yes, the bathroom isn't great, but it's a lot of fun, a lot of socials. You're close enough to campus. And then that's first year, you have opportunities to live in student com. Second year onwards, generally most people at least will get their own accommodation with friends. Some people do manage to get student accom second year round, but they're normally prioritized to people who's under CAS, which again, look into it if you think you might be eligible. But CAS is a King's affordable accommodation scheme, which lowers the prices significantly if you're within a bracket of eligibility.
Definitely, pretty much the same as what Jenny's saying. I mean, I'm literally in Great David Street right now, so it is definitely a very social accommodation. Not the prettiest accommodation, but it's very like good in terms of location wise, easy access to campus, and the fact you don't really have to get tube or bus to pretty much anywhere around campus as well, because you're only at walkable distance. So it's pretty nice. And one thing you've realized with GDSA is that everyone here is pretty much in medicine, dentistry, or similar courses. So you'll meet a lot of people that are doing the same thing as you. So it's quite fun in terms of socials as well.
Yeah, and obviously that's not the only ones. That is, I
Yeah,
think, the cheapest one. There's another one that's fairly cheap around campus.
I think it's
But you don't
is it
get on suites.
Wolfson House or like
Wolfson
Orchid
House,
Island
Orchid
Brook.
Lisle, yeah. And there's some bougier ones as well. If you want to branch out a little bit, Battersea, Canada Water, great ones. Just look on the website is all I'll have to say. We'll stop the chat questions, but the three people with their hands up, is there any burning questions that you have?
Yeah, I got a question about contextual admissions because I looked around online and people were saying like historically for the past few years, people who have contextual admissions to KCL, if it's like postcode staff, young carer staff, they usually get their interviews, if they do get them, later in the year compared to like non-contextuals. Like apparently like KCL filters them out and does like non-contextual applicants first and then they give interviews to contextual applicants afterwards. Is that true? Or
Honestly, I'm not sure. In terms of contextual, there's also the ESDP course, enhanced, was it? Enhanced
It's a
support.
enhanced support dentistry program.
Yeah, that, which will just be on a different timescale. I know lots of people are asking questions about it on the group chat. But for the main course, like just the BDS course, generally, I have no idea, to be honest. I don't think so, is what I would have said. Do you know?
I have no idea to be honest. I can imagine for ESDP it's definitely like a different pooling
Yeah.
system. For contextual with BDS, I'm not too sure either. I don't know how they will rank or score.
Honestly, patience, just wait for it, and I promise it will come if it's
Kings is
good.
notorious to be slow,
Yeah, they're
so
notorious.
I
So,
would not worry too much, especially in January as well, because
mhm.
I remember I did my interview back in December and I got my offer all in April. So it's a long, long wait compared to other universities as well. So you just have to be patient for it.
okay. And you said that the latest interviews they give are until like March or something? Is that
Late
On the
March, I think.
Yeah, on the website they say they run interviews between December and March. So that's typically their time periods. I'm not too sure about specific dates, but I think that's just at least what King says on the website.
oh, okay, thank you.
Yasmin, do you have a question?
Hi, yeah, I was wondering if there's a recording for the meeting so I can like go over some of the points again.
I think it should be, it is recording at the moment. I will
Hmm.
have to check with Ojas, or if, I don't know if he's here or not, but that should be sent out to you. I hope
Okay,
you will get access in some way or another because it is recording.
okay. Thank you.
No worries. Okay, someone said it's on YouTube. I I think that is correct, actually. I did hear about
I
someone
think that's
bad.
true as well. I think just give it a couple of days and it'll probably be published on there somewhere.
And if you are confused, the chat will say. Oh, well, I'll make sure it'll be on the chat somewhere where to access this. And then last one, iPad. Do you have a question? Okay. I can assume that's a no then. We'll leave it there for today. Thank you very much, everyone, for joining. Hopefully that has been useful and I mean, we might have opportunities for Q&As, etc. later on, but otherwise, absolute best of luck for all your interviews. Go and smash it. And really, really hoping that we will both see some of you at KCL come September. I'm really excited.
Thank you guys very much for the session as well. Thank you for all joining.
Hello.
Hi.
Hi. If you just want to try sharing the screen so we can see the slides, and I'll get Amna to join as well, and then you guys can have a go at practicing, maybe who's saying what.
Okay, that's fine. I've just the Amna slide, so I'm just going to send myself the link. I'll be a sec.
Okay, perfect. That's fine.
Can you see that or? Sorry, I've just stopped my share because I feel like you should probably share it, seeing as they're your slides. So
Yeah, I can share them. Okay.
I don't mind doing that as well, but is it going to be like we both share it when we speak, or are you just going to like control them? Like I don't really know what's
You
best.
can
I
you
think one person just share them, and then when you're done speaking about that, just change the slide, but just keep it one person sharing.
okay. Do you want to share the slides as if because you've already had them opened? I
Yeah.
don't mind, to be honest.
Actually, wait, do you mind if you do it? Only because I've got some like notes and I don't want them to show when I'm like speaking.
Okay, no worries. Okay. Our cameras need to be on once everyone's in, right? Or
Probably, yeah.
yeah. Okay. Hi. Okay. I'll see if I can
Reclaim host to stop the recording.